aware that at around 5:30 yesterday evening, 17 people from New Zealand, having travelled on an international flight from New Zealand to Sydney, were then allowed to board a plane and travel to Melbourne. They didn't spend very long at the airport. They left the airport within only minutes, really, of having arrived. Our officers have absolutely no power to stop someone, to detain someone but in those circumstances, particularly given that they were coming from a very low virus part of the world. New Zealand is, and we're very pleased for them, in a very different set of circumstances to the circumstances that we're in Victoria. We are still waiting. I'm not quite sure why we're waiting, but we are still waiting for Australian Border Force to provide us with the passenger cards for each of those 17 people. As soon as we get that detail, we will be visiting each of those people and making sure that they are fully up to date, as it were, when it comes to the rules, the regulations, the structures that we have in Victoria. They need to be briefed on those things so that they're doing the right thing. I'm not sure that any of them would necessarily need to be tested, but of course just giving them the benefit of a clear understanding of what's required in Victoria, whether you're from Victoria or not, is very, very important. I just want to be absolutely clear on this. I've written to the Prime Minister this morning. We're very disappointed that this has happened, given that I had the previous day, or maybe the day before, written to the Prime Minister on this very issue, saying that at some point we will join that New Zealand-Australia travel bubble, but that's not appropriate now. This is effectively possible because we have not closed our border. I don't think these people could have travelled domestically into other states where borders are closed. That's exactly what the Prime Minister wants. We have done that, and now we see 17 people turning up on our doorstep without any notice, without any structure, and we still can't even get the cards from Australian Border Force as to who these people are and where they have gone. We hopefully will get that very soon. But I have written this morning just to make it plain. There's more flights coming on Sunday from New Zealand, and we do not want a repeat of this, where people, albeit we're not having a go at them, those 17 people or whoever might seek to come to Melbourne or come to Victoria on Sunday, but surely it's not beyond those who are responsible for the borders of our nation, making sure that only those who are in that New Zealand bubble can receive domestic passengers after they have arrived into an international airport. I'm confident that we'll get to the bottom of this by the end of the day, and we'll be in contact with each of those people and just make sure they know and fully understand what the rules are, what they have to do, masks, all the way through to those reasons to leave your home, so on and so forth. But I just thought it was appropriate to give you some background to that.
Just before you go on there, were you aware of the legislative position that there was no power to detain?
Well, I'm not certain, Noel, because I don't think we'd ever really turned our mind to this happening. Our position had been very clear. We are not in the New Zealand bubble. So we certainly know now that if there's unauthorised arrivals, if people are arriving and we just don't know, we have no way of knowing, we can be clear that there's no international flights arriving into Melbourne. But what we can't be clear on, well, I think we are now, but we couldn't last night be clear on the notion of them being allowed to freely travel from Sydney. So I'm confident that we won't see more of this until we get to the point, and I am confident we'll get to the point fairly soon, maybe, where we can have people from New Zealand travel, and indeed people from Victoria can travel to New Zealand if they think that's appropriate. But at a time when Victorians can't freely move around their own state for the best of public health reasons, it's not acceptable to me that people from another country, when we've expressly said that we don't want this to happen now, are able to get into Melbourne without us knowing. No warning, no. In fact, it's exactly the opposite of what we signed up for. It's happened now, it can't be undone. But our focus is on getting those cards, getting to those people, having a conversation with them about what's required of them now that they're in our state. Noel, the other point is because we haven't got the cards, I can't tell you whether they're New Zealand citizens, whether they're Australian citizens. I know where they came from. I know how they got here. As a matter of fact, in terms of the method of transport, I don't know how they got here in a policy sense, because I had been express in my view that this should not happen now. It can happen in weeks or months' time, but it can't happen now.
Where are they right now?
Well, until Australian Border Force give us the cards, we have no way of knowing.
Are they in Victoria?
They are in Victoria, and we assume they're in metropolitan Melbourne, and we will make contact with them as soon as Australian Border Force provide us with the cards, those disembarkation cards that we've all filled out many, many times. And hopefully by the time I finish standing up here today, those cards will be available.
How frustrating is it that it's taking so long? Is that upwards of 12 hours?
Well, it's a lengthy period of time. The good news is they've come from a very low virus place. It's not like they've come from some other parts of the world that are absolutely hotspots, but again, we'll get to the bottom of it and we'll make contact with them, and then we'll focus our energies not so much on being frustrated on what's happened, but making sure that we prevent any further people arriving unless and until we get to a point when we can accept and be part of that bubble. We're not opposed to that, and we're not for a moment casting aspersions on the state of public health in New Zealand. What we are just simply saying is surely our systems are better than this. Which I think is a fair thing to say. I stand here every day making sure that every Victorian knows they can't just freely move around their own state for the best of reasons, and at the same time we've got people being allowed in from another country, and we were literally the last ones to find out about it. It just doesn't make any sense.
Should they be fined then? Should they face a fine?
No, I don't know that they've necessarily done anything wrong.
Broken any rule?
Well, again, that'd be looked at, but I don't think so. But what we're really keen to do is to make sure that we have a conversation with them and that they know, you've got to wear a mask, the whole checklist of things that we're all very well used to. None of us are pleased about it, but we know about it. We need to be confident that they do, so that they can
send them back.
Well, let's work out who they are first and where they are, and we'll be able to do that once Australian Border Force provide those cards, which my advice as I walked in this morning is we haven't got those yet, but hopefully we'll get those very soon.
But if they're not Australian citizens, then should they be asked to leave?
Well, let's first of all work out. Well, see, I don't issue visas. I don't control the free movement from other countries into our country, and nor do I want to. That's not a matter for us. That's a matter for the Commonwealth government. The bubble arrangement is a perfectly reasonable thing, but not to Victoria at this time, and that's why we made that point clear. That would appear it hasn't gone through down to the level that it needed to, and these people have arrived, done nothing wrong in arriving in Sydney, but then they themselves haven't done anything wrong in trying to come to Melbourne, but they shouldn't have been allowed to come to Melbourne because we've not signed on to that bubble. It's very difficult to know about what their status is and the notion, to answer your question, until we know who they are, where they are, and what their status is. For what reason are they here? For all we know, and this is the most challenging part of it, because we all ought to know much more than we do, but the system has not worked particularly well. They could be from our state. We'll just have to wait and see.
At what point in the timeline here did authorities realise that this is happening? Like, were they off the plane and into metropolitan Melbourne before someone picked up on it? Do you know?
I'm not certain at this stage. I first became aware of this in the early part of the evening. But I think the timeline is they'd arrived at about 5:30. We're out of the airport by about 5:40, we think. And again, no one's alleging that they've done anything wrong. It's just a matter of there should have been a process when they tried to board a domestic flight to travel within Australia after having arrived at the international terminal in Sydney. Then the answer should have been no. Well, sorry, where are you going? Well, no, you can't go to Victoria. Victoria is not part of the arrangement that's allowed you to come to New South Wales.
Who should have been doing that, having that conversation with them, do you think?
Well, again, that'll be for others to judge, but I can certainly tell you that it's not the Victorian government. We don't make a habit of advising people of things at Kingsford Smith Airport. That's, it's in another state. So I've written to the Prime Minister this morning, not to do anything other than say, look, this shouldn't have happened, and I want everyone to work hard today to make sure we don't get more of these people arriving on Sunday, because there are more flights due then. At the end of the day, let's avoid all the inconvenience. Let's avoid, certainly for anybody who may have formed a view for whatever reason that they can travel from, say, Auckland to Melbourne. That's not on offer at the moment. It will be, and just as in the weeks and months ahead, travelling from Melbourne to Auckland may well be something that people want to do, but now's not the time for that.
Who will visit them today? Who's responsible for visiting them and explaining?
I think the Victoria Police will, and authorised officers under the Public Health and Wellbeing Act. Again, no one's asserting that they've done anything wrong. It's just a matter of making sure that they fully understand and appreciate what the rules are in Victoria, how they need to conduct themselves, and how they can play their part in making sure that we protect public health.
And at this stage, while you don't know much about these people, at this stage your understanding is they haven't. There's no suggestion they've done anything wrong. That they.
I don't believe so. No.
Is the border arrangement sold to New Zealanders that you can come to New South Wales or the Northern Territory? Is that made clear to them?
Well, obviously it wasn't made very clear to these people, these 17 people. So there's perhaps some refinements that need to be made across this entire arrangement. But I don't fire off letters to the Prime Minister unless there's a need to make things formal. And our formal position, which hasn't changed, our formal position is that we are not ready to accept people into our state from other countries, even New Zealand, particularly while Victorians themselves, and particularly Melburnians, don't have the freedom of movement that they want and that they're absolutely entitled to. We're going to take some steps tomorrow. We're going to outline what the coming weeks look like. We don't want anything at all to undermine the amazing job that Victorians have done and are doing, and I'm confident will continue to do, in order to find that COVID normal. So some things have gone wrong here, but we're very much at the end of that, not necessarily part of it. In fact, we had made it very clear that we did not want to be could not be part of those bubble arrangements at this point in time.
Should Victoria consider at least temporarily shutting its border to make sure there isn't a repeat if it can't be?
Well, I know that the Prime Minister would be, I think, very disappointed if that happened. That's exactly what he's trying to avoid, and that's why I wrote to him this morning and made it clear that we need to get to the bottom of this, and then we need to have the requisite assurances that this won't happen again, and that would then avoid us having to do that. I don't want to be closing our border. It has remained open. In fact, I want us to play our part, and one case today, and now active cases down under 150, we are playing our part in getting the borders across the country open. We don't want anything to jeopardise that.
Just one number, so one additional case. It's a remarkable achievement, really. And again, my congratulations to Victorians, but also to the pathology services who've, as we know, done thousands of tests, processed thousands of tests from Shepparton and thousands more across Victoria, and the public health team that I'm proud to lead, all the work, the thousands and thousands of hours that are put into the intelligence and epidemiology, the analysis and the modelling, the contact tracing that has been able to drive us down to this one additional case for today.
I'm not sure if you saw a tweet from Greg Hunt about 9 o'clock. He said epidemiological conditions for COVID, safe reopening of hospitality, movement and family reunions, among others, in Victoria he's talking about, have now been firmly met. Victoria should now be able to move to the next step in line with New South Wales. Is he right?
We have epidemiologists. I'm listening to them. We've got a team of epidemiologists who are working through this. The conditions for easing in New South Wales after their first wave were actually they'd gotten to a 14-day rolling average of under 4, I think it was. We're at 8 today, so we're not in an equivalent position. It's fantastic to have a 2 and a 1 in the last 2 days, absolutely fantastic. But we're at 15 a few days before that, so we do need that time to see that we've got an average that is actually what all of those epidemiologists are telling us is safe. We will be making announcements tomorrow, and there will be an easing, and we'll continue to go through that process, which I've optimistically referred to as a one-way process. We want to go to an easing where there's no backward step, where we do it with the confidence that it can stay that way and that everyone can enjoy that into the long term. So we'll do that for this weekend and in the days ahead.
He's jumped the gun?
Look, Minister Hunt's not an epidemiologist. I guess he speaks to other epidemiologists who might have differing opinions. We've gone very broadly for our advice and modelling and inputs. We take the positive critiques and negative critiques equally, and people will have different opinions. But there's no question that the stakes in this are enormous, and the consequence of not being able to hold it back if you're lifting too early has already played out in Victoria. And I think there are 7,000 ICU cases in France at the moment. There are countries where 90% of ICU beds are taken up with COVID patients. We've clearly avoided that. We've got 13 hospitalised patients. We're in a very, very good position. But we don't want to be playing with risks that are unreasonable. We've taken a slow and steady approach for a reason, and it's borne out. It's borne out in regional Victoria in terms of maintaining that status where they're not getting ongoing local transmission. They've had introductions into regional Victoria, but otherwise appear to be free of the virus. That's a really fantastic achievement. And the same for Metro Melbourne. To be gradually going in this one positive direction is a remarkable achievement.
I might add to, Brett's a public servant and perhaps I'm a bit less constrained when it comes to some of these matters. If Minister Hunt is genuinely suggesting that, we're keeping this lockdown on because somehow we think Victorians are enjoying it, or it's a choice that we're making, like, this is just, it's just wrong. And I'll boldly predict that whatever I stand up here tomorrow and announce, there'll be members of that federal government, some who are from Victoria, but I don't think they're for Victoria, who will be out there saying it's not enough, you should have done more, no matter what I announce tomorrow. And what that says to me is that, we're not going to be pressured. We're not going to be engaging in what I think is a political exercise. And it does no credit to those who are involved in it. I don't know how many times I have to say it, but I'll say it again. Politics, this sort of stuff just doesn't work. It doesn't work against this virus. Other governments, other ministers, people, they're entitled to have their view. But please, no one should be suggesting that the Chief Health Officer and I and others are keeping these restrictions on any longer than they need to be, any longer than the advice says to us this is an appropriate response, so that we can open up. We are not going to risk everything that Victorians have sacrificed. And whilst people are entitled to different views, some people should reflect on the fact that they are in fact a health minister, and that actually requires a certain standard, I would have thought. We're going to see this thing off, and we're going to do it properly. And I've probably said more than I frankly intended to, and more than I'm inclined to, about people who are, I think, playing games. And this is not a game. The stakes are too high. Everything that's been done, everything that's been given, needs to count for something. And that's why this strategy is not about racing to open up, running to COVID normal. It is about safe and steady steps. And tomorrow, just tomorrow, we will make significant announcements. And we'll have more to say about what the next weekend looks like and the weekend after that.
But he's not just referring to his opinion. He's saying that epidemiological conditions for a COVID-safe reopening.
With the greatest of respect to him, it is not for him to determine whether epidemiological conditions have been met. He is not an epidemiologist. He's a politician, and I think he's making that very clear to everyone who follows his tweets, and everyone else who listens to his criticisms, and everyone else who gets briefed by him and those who work for him. I'm done with this. It's an insult to the sacrifice that Victorians have made. Politics doesn't work on this, and I'm going to call it out wherever I see it from now on, because there are some people who have played politics every day of this pandemic, and Victorians are sick of it. They're also pretty sick of these rules, and that's why we're going to get some of them off tomorrow, because we've done an amazing job. Every Victorian, no matter their background, their postcode, their circumstances, people have stayed the course. We are right on the edge now of defeating this second wave. It's not occurred in many countries, if any, across the world. And you look to Europe, you look to parts of Asia, you look to North America. It's heartbreaking what's going on over there as they move into winter, particularly in the other hemisphere. That this thing likes the cold. That's what the evidence tells us. So we have avoided that, and we aim to continue to avoid that. And there'll be significant announcements tomorrow.
You stand by Professor Sutton, who is obviously standing by you physically right now, but do you...
Well, he's not only standing beside me physically, he's standing beside every family across Victoria. And the work that he and Alan Cheng and all the other team have done is a credit to them and the teams they lead, and they have my complete confidence. And one of the reasons, I know I mentioned before, that tomorrow we'll be able to make some announcements, and that's all down to the good people of this great state who have stayed the course on this. But it's also in part due to the quality of the advice we get and the fact that actual epidemiologists, not politicians, are not engaging in anything other than a public health, so save lives, and then we can move to save livelihoods. That's what we're going to do. And tomorrow